Hello, my friends. Today we're going to talk about a fascinating case, which is my topic, like my baby, and it's root resorption. What is root resorption? Root resorption is the destruction of the mineralized tissues created by the osteoclast, which is the cells that remodel the bone. When we have an accident, the cells start destroying the bone cells, which are osteoblasts and osteoclasts, they start destroying the bone. But when they get close to the area of the trauma, which in this case is the teeth, they continue the destruction because they don't understand what is a tooth and what is the bone. And what the bone is formed with hydroxyapatite, and it's the same on the teeth. We have the roots, everything is covered with hydroxyapatite. So the cells continue eating your teeth, and now the American Association of Endodontics call it a condition. And it's not a disease, it's just a reaction to a trauma that the cells are gonna have. Why do I know that? Because when I started my PhD in molecular biology, I was able to study to very deep level this type of treatment. If you go to the dentist and he said, there's nothing to do, I don't know what it is, I'm gonna lose my tooth, you need to have extraction, be sure to send me a comment or go to an endodontist. And if the endodontist also tell you to get the tooth extracted, be sure you can text me, send me an information, and I will be very happy to help you with any charge. So this is the way you're going to look on the x-rays. When you have an x-ray and your dentist says, look, this is root resorption. This dark area, that's where the tooth is gone. The patient never cared how her teeth are going to look, and he was not going to do veneers or any invasive treatment. He was only have a restoration after the root canal. So when I remove the material, the tooth looks like empty, like the roots were gone. And it's the way the angulation of the x-rays is. But what is happening now? You see this dark area? When I finished the root canal in 2012, look, it looks very different. And they were 3 teeth together. This one was not as bad, but I bring the patient every 3 months. He was coming to have his teeth cleaned, and I asked the periodontist to please don't clean hard the teeth. And after the cleaning, after the 3 months, the 3 months that he was coming, 2 years later, we find out that resorption was being successful. Usually I send the patient for a CT scan at UCLA. I personally love sending my patients to USC or UCLA, but UCLA is extremely well organized, and they send me the report just like if I send it to USC. So UCLA is closer to my office. So when I saw the patient, he said, I don't want to have a CT scan, please do the treatment. And I agree, because if the tooth is draining or is a lot of blood coming out, most likely it's external. We were very lucky because this resorption, it was internal. However, the tooth was very weak, very thin, and we have to be very careful. But the material that we use, which is MTA, it's an amazing material that regenerates the tooth in many ways and stop the cell mobility. So when you have a root canal like this and your dentist said to be extracted, be sure to tell them to do a root resorption treatment, which is a root canal plus the treatment with the material that we use. Now imagine the patient, when I see the patient 9 years later and I look at the tooth and they are exactly the same, the root actually start regenerating, which I never thought about it. Then finally he accepted going to UCLA, have a CT scan, and what did the CT scan do? They will show me that slice. It's like you're cutting an apple or anything that you're slicing, and then you're gonna see the spaces. And when they told me that how well it was, the bone, the tooth, and the resorption did not advance, I am very happy to tell you that root resorption treatment works, and it has to do with diagnosis. If you're grinding, you have to wear a night guard, otherwise the treatment will fail, and you need to have a good brushing and flossing technique. Look at the episodes that we have in YouTube where I explain, in Instagram and TikTok or Facebook, when you're gonna find the techniques. YouTube has the very first videos well done with a very much detail on brushing and flossing. I hope you like this episode, and I hope to see you soon.